Hey, Facebook fam. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. We're here for another episode of Wellness Wednesday with Dr. Latoya Wells. I am so grateful that you're here tonight. We're going to dive right into things. I have a question for you. Let me ask you that question. When was the last time you had your physical exam? Not when you're sick, not when something's going on, but like your annual wellness exam. This is something, as you know, we've been talking about this for a long time. And as you know, your annual wellness exam is top tier, right? It's something that we need to put up there on our to do list and our scheduling, making sure we get that taken care of. And one of the things I find is that not many people are scheduling their physical exam. Not when you're sick, not when something felt wrong, but when everything felt fine and you just scheduled that appointment, being proactive about your health care. Yesterday, I was a part of a study and we were talking about genetic screening and testing and preventative care and all of that. And the numbers were astounding on how many people do not schedule an annual wellness exam. They only go to the doctor, they only make those appointments when they're not feeling well and when something feels off. But very few people are scheduling those wellness exams to where you're just going in, getting everything checked out, being proactive about your health. And it's so important because a physical exam is not just a routine visit, it is a preventive strategy. I'm sorry, I got a little dog over here making all kind of noise on the side of me, so I apologize. So tonight we're gonna be talking about that. Let me back up, let me backtrack. I'm Dr. Latoya Wells. I'm so excited to talk about this tonight. I'm Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. And if you haven't heard, we're in the office full time. That's right, full time. We're still offering early morning, evening, and weekend appointments. We're still offering in home, virtual, and in office appointment. We are also offering walk in appointments. We do ask that you call, make sure that we have the availability, but you are able to come in without an appointment upon availability, right? Based on availability. But I'm so excited to be able to provide full time care to my patients and just offer additional services that we're going to be discussing later. But I wanted to reach out. I just wanted to put that out there. Please share the information if you know someone who is in need of an annual physical, if you are in need of an annual physical, or if you know someone that needs a primary care provider. We are family, so we see newborn to 100 plus years old, right? And so we, from the beginning all the way up to the end. And so we're here for you. I'm just excited about all that is happening with Wells Legacy Health and Wellness. And I almost forgot my introduction, but hey, share the information, tag, like, and subscribe. Tag, like, share. If you are not following us on all the social media platforms, please do. We're on Facebook, Instagram, Lemonade, TikTok. Yeah, I think that, and YouTube. Yes, also YouTube. So follow us on those. But your physical exam, it is a preventative visit. It's something that we do to make sure that we're up to date on all the things, that there's nothing going on, that we can kind of be preventative and proactive when it comes to our health care. And so tonight we're going to talk about, what do you expect on your physical exam? How do you prepare for it? What questions should I be asking during that exam? And how do I know if the provider is a good fit, if they're a right fit for me? For me as a healthcare provider, I know how I want to be treated. And so I take that into consideration when I'm taking care of my patients. But as a patient, because I do go for my physical exams every year, my annual and or preventative visit once a year, and that means that there's nothing going on. And so that physical exam is so important because they're assessing, your healthcare provider is assessing your overall health. They're detecting any early signs of disease. They're making sure that you're updated on your screenings in your labs. And then they're discussing lifestyle and risk factors, such as, is there anything that you need to do in terms of changing or adding things or taking away things from your diet, talking about family history and things of that nature that are so important as we are looking at your health long term. The focus here is prevention and not just addressing problems. And so Can you discuss problems during this visit? Are you able to have conversation based on things that come up during the visit? Absolutely. Some key things I want you to know is that chronic disease like heart disease, diabetes, hypertension account for most of the deaths in the United States. You guys know I love my statistics, so I wouldn't be me and it wouldn't be Wellness Wednesday if we didn't include those. Many of these conditions are preventable and are manageable when they're caught early. That starts with showing up, right? You have to show up for these appointments in order for us to be able to detect and to screen and do all the things. And so, what's happening during that physical exam? I had a potential patient call me. She's actually a patient now. Thank you. If you're watching, you know who you are. She called, and the first question she asked me was, "Are you accepting new patients?" Yes, we are. Check. The next question she asked me, "Do your visit last longer than 15 minutes?" And I said, "What visit lasts 15 minutes? Like, where are we doing that at?" Right? I didn't say that to her, but in my mind, I'm like, what are we doing that? Because a physical exam takes longer than 15 minutes to complete. And so, yes, it does. And we're going to talk about some of the things that are included in that visit, and you'll understand why it takes more than 15 minutes. So, the first part of that is a health history review. Your provider should be asking you about your personal medical history. Have you been in the hospital? Have you had been diagnosed with certain conditions? Are you taking any medications? Have you had any surgeries? All those things, right? Do you have a history of smoking? Such things of that nature. Your family history, heart disease, cancer, and diabetes. Because if you have a positive family history of any of these things, then it helps us, Lola, then it helps us to better plan prevention, right? And screening. Medications, what medications are you taking? What supplements are you taking? And many people don't understand that eye drops, any creams and ointments that you're taking, medications that are vitamins and supplements that are not prescribed by a provider need to be discussed and divulged to your healthcare provider. And why is that important? One of the most important reasons is that, let's just say something happens and you get sick and you have to go on a medication. If if I'm your provider and I don't know everything that you're on, I could potentially prescribe something that could interact with one of the supplements or medications that you're taking. So it's so important that we know what you're taking, like all of the things. If it's a supplement you just bought because somebody told you it was good to take, we need to know those things. We need the name of the medication, the dose of the medication, and how often you're taking it, as well as any supplements that you're taking. Some people come and say, "Oh, I'm taking vitamin D." Okay, what's the dose of the vitamin D? How often are you taking it? Is a tablet, it's a capsule. We need that information. So, how do you prepare? We'll talk about that a little early, but I want to put this out there. Make sure that you have a up-to-date list of medications that you're taking and carry that with you. And it's not just so you can provide it to your healthcare provider, but if something were to happen to you and paramedics or emergency personnel need to know what you're taking, they have that information. In many of the phones, you're able to put your health history information in your phone. And if you have in case of an emergency contact, for me, it's my husband, my best friend, and my sister. And so if something were to happen to me, healthcare professionals or emergency medical can get into my phone and know these are my conditions. This is what I'm taking. These are the individuals that you need to call in an emergency situation for me. Next thing we want to talk about is lifestyle habits. Are you on any type of diet, restricted diet, anything that you've been told that you cannot eat? Do you have any allergies to foods and medication, things of that nature? How often do you exercise? How active are you? Is there anything that's preventing you from exercising? Sleep, how is your sleep? Difficulty falling asleep, staying asleep? How many hours a night are you getting? Do you wake up rested? Do you have a trouble falling asleep or staying asleep? Stress, what's your stress level? Let's talk about that. Any alcohol, any tobacco use, we want to talk about that. Any vaping, things of that nature. So we have to make sure that we're in a space and we feel comfortable to be vulnerable with our healthcare provider and to be that we trust them to like divulge all the things because all of these things are helpful. The next thing the provider is going to do, or they may have someone in the office assisting them, but they're going to do your vital signs. They're going to obtain your vital signs, your blood pressure, your heart rate, your temperature, your weight, your height, so that they can calculate your BMI. These numbers are very important to help identify risk early. If we're noticing that the blood pressure is a little elevated or that the heart rate is elevated, things of that nature, or if the BMI is over what it should be, then we can put different things in place to kind of help you. And as someone who is not a provider that wants to just throw medicine at a patient or a client, we'll talk about and discuss reasonable, realistic options. However, there are some times where medication is needed, and we can have those conversations around that. And you should be able to feel comfortable having that conversation with your provider. The physical assessment, this is the good part, right? Where I get to touch and feel and listen and poke and prod and look. I get excited about my physical exams because I want to make sure that I am examining my patient thoroughly, that I'm doing all the things that I can to make sure nothing is missed. Many times, if providers are rushed, patients don't have enough time to ask questions, things get missed, symptoms get missed. And I want to make sure that I'm taking time. So I do a thorough physical exam. And each provider, when you're having your annual exam, should be doing a full physical exam. Many of them will ask you to take off your clothes, have you put on a robe or a gown, and they will look at your skin. They'll listen to your lungs. They'll listen to your heart. They'll check your abdomen. They'll kind of touch and feel the belly, see if there's anything hard. They're going to tap on the abdomen so that they can hear over the organs, making sure nothing sounds abnormal. There's no pain when we're pressing on the belly. We're going to listen and make sure that we can hear your bowel sounds and all the things. We're going to do a skin check. I'm going to have you, if you're in the gown, I'm going to take a look at your back, and I want to make sure there are no moles, there's no rashes, there's no open areas. If there are any moles, did they look the same as they did last year when we did the exam? Is there anything that we need to be concerned about? Your skin is the largest organ of your body. And if there's a breach in your skin, an opening in your skin, it puts you at risk for developing an infection. If there's a mole that's changing, that puts you at risk for melanoma or some type of skin cancer. So we want to make sure that we're really doing a really good job at assessing these things. We want to take a look at the neck. We're going to feel the thyroid. We're going to touch it, make sure that there's no nodules or enlargements going on there, that there's no pain in the neck. We're going to listen to those blood vessels that are on the side of your neck, which are called the carotid arteries. Make sure that there's no abnormal sounds, no breweries or anything. We're going to check your neurological system, your strength. I'm going to have you, I'm going to push, pull, have you squeeze my fingers, check the reflexes in your lower extremities and your arms and your legs, feel your pulses, all of the things. And then, depending on the age, the gender of the patient will determine if we're going to do a breast exam, a pelvic exam, or a prostate exam during that visit with your consent. And know that you can always refuse any part of the exam. Right? You can ask any part of the exam to be excluded. If you're uncomfortable with something, make sure you're telling that provider that you just don't feel comfortable, things of that nature. Another thing that we're going to do is we're going to check your eyes, your ears, your nose, your mouth, all of the things, right? To make sure everything looks good. I'm looking at the eardrums, making sure that they're clear. There's no fluid, there's no redness, there's no bulging, things of that nature. That there's no wax that's impeding the ear that's preventing you from being able to hear. Looking in the eyes with the ophthalmoscope, making sure that I can kind of visualize those blood vessels in the back of the eyes. All important. So all of that is so important. Another thing that we're going to do, and we're going to order most likely, is based on the age and your risk, blood glucose levels, your sugar levels, or A1C, cholesterol panel, kidney and liver function. We want to look and see how your kidneys are doing. And this is all going to be done with lab tests that you're going to go to the lab and have done. Labs to check your thyroid. Many of these we need you to be fasting at least 8 to 12 hours for, so that we can get the best result of it. Other screenings that may be included is the colorectal screening, especially if you're at age 45 for most adults. And if you have a family history, we may order those screenings earlier. That's not something that we do in the office. We can give you something called a FIOBT, where you can complete it in the office and we send it to the lab, or we'll send that home with you. You're able to take some, a stool sample, put it on the card, seal it, send it back to the lab. They'll test it for presence of blood. mammograms, pap smears, which are absolutely done in our office with our physical exam, based on the timing of when you had your last one. Bone density is something that we can order for women and men who are at risk for it. Typically, you see it more in women. However, men should be screened for it as well. Um, I had a friend who did a talk a couple weeks ago, and she was discussing the discrepancy when it comes to bone density screening for men and how it kind of irks her. And I have the same sentiment when it comes to that because men can also develop osteoporosis. Another thing that we're going to talk about is mental health and a lifestyle check-in. The, as a provider, I'm going to ask you, how is your sleep? How many hours are you sleeping? How is your stress? How is your mood? Are you moving your body? I'll do something called a PHQ-2, which is a mini mental health exam. In the last 2 weeks, have you felt down, hopeless, or depressed? The second question is, have you lost pleasure or interest in doing things that you usually enjoy doing? And based on those answers, if there's any positive responses, we'll do something additional called a PHQ-9 and then potentially a GAD-7 screening that's going to be screening for anxiety and things of that nature. Recently, I had a patient who was dealing with some depression, and it was important that I asked those additional questions and asked some probing questions to make sure that we were getting the full assessment, the full picture, because your health is a whole person situation. It's not just part of it, it's the whole person's health. It's not just a little piece of it, but you need to make sure that we're getting all the pieces to make sure that we are assessing you holistically. One of the things that I don't think many people are having conversations about or are taught or encouraged to do is to prepare for the appointment. For many providers, when you schedule your appointment, if you're a new patient or if you're going in for your follow up or your annual exam, many times there's paperwork that needs to be completed. And so they will send that information. A lot of the hospitals and doctors' offices now are utilizing something called electronic medical records or electronic health records. And so you get all of your questionnaires and consents and things via email. One of the things you want to do to prepare for your visit is write down any concerns or symptoms that you have. Patients who write down questions and their symptoms have better outcomes when it comes to getting answers and leaving those appointments feeling as though they accomplished something and that they understand the plan of care and what's going on with them. You want to track your patterns if you're having pain, if you're having fatigue, if you're having issues sleeping and mood changes. And many phones and many apps now have habit trackers, they have mood trackers. And so you can kind of pinpoint that and be able to have that conversation with your provider. Like 5 out of 7 days, I'm having trouble falling asleep or staying asleep. You know, my mood seems to be up and down, things of that nature. I've been feeling really tired every day for the past 2 weeks, and nothing different has changed. You want to make sure, as I mentioned earlier, bring a list of your medications and any supplements that you're taking, including eye drops, any injectables, any ointments, any cream, any supplements or over-the-counter medication that you are taking that have not been prescribed by a healthcare provider, but also those prescription medications. And then also know your family history. For some individuals, that's not feasible because either they don't know their family or they don't talk about things, which is another thing that we need to really talk about, is making sure that we know what's going on within our family, especially when it comes to health, because it not only impacts us, it impacts the generations to come. And in order to create a legacy of good health, we need to be able to have these important conversations. So if you are someone who doesn't know how to broach that conversation or to start that conversation with your family, reach out to us. We can give you some tips and tricks on how to do that. Bring your previous medical records if you have them, especially if you're a new patient. If not, there's some paperwork that you can complete and we can request, and your healthcare provider can request records from your previous doctors. Having that information is really helpful. It's a big piece of the puzzle when it comes to your healthcare journey. What do you do the day of the appointment? Don't be like me and always rushing. Arrive to your appointment early. Make sure you bring your ID and insurance card. Make sure you know your deductible or copay. The provider's office will verify that, but it's ultimately up to the patient to know what their deductible amount and if they've met their deductible and things of that nature. There's nothing more frustrating for both the patient and the provider or the staff in the office for a patient to get there and the patient to be surprised by a large deductible or copay. And it can cause abrasion for the patient. So I encourage you to know that information up front. Many health insurances now have apps. You can go on there and see what your copays are for your primary care doctor. And for many of our annual wellness exams, there is no copay. There's no deductible because that's a part of your plan. But know your insurance because not all insurances operate the same. Make sure that you fast if you have blood work done. Many times, doctors' offices or providers' offices offer labs in house, and if you have an appointment early in the morning, if you fast, they can get your blood work drawn there. If your appointment's in the evening, don't fast all day unless you just want to. However, it's best that if you have a later appointment, that you schedule the blood work for a time where you're able to fast throughout the night or early in the morning. Make sure you wear comfortable clothing that's easily accessible so that you can take it off and put the gown on or the robe on and be prepared for that appointment. And then bring your glasses or any assistive devices that you need, hearing aid, things of that nature. Prepping your mindset when it comes to that appointment. Come in ready to engage, not just listening. This is a two-way street with you and it's not, I can't think of a word, but it's not monologue, it's dialogue, is what I wanted to say. There should be some dialogue between you and your healthcare. And typically what I'm hearing is for many who are getting in and out and having those really quick conversations, they aren't able to have that dialogue with their provider the way that they usually would have. And so it's important that you're not just a patient, but you are a participant in your healthcare and you are to be able to advocate for yourself. And we're going to talk about how you do that. So what are some questions that you should ask? This is where many people will fall short when it comes to their healthcare, is we don't ask questions. So having those key questions that you want to ask your patient is going to be very important. Very, very important. So yeah, understanding and knowing what questions you should ask is so important. So here's some key questions that everyone should feel comfortable asking. What do my numbers mean in terms of your blood pressure, your respiration, your heart rate, your labs, things of that nature? Are my labs optimal or are they normal? And I'm going to do a talk on that. So just catch me on social media about that because I'll be discussing the difference between optimal labs and normal labs. And what are my biggest health risks? What am I at risk for? What do I need to be paying attention to? Things of that nature. When it comes to screenings and prevention, what screenings do I need at my age? How often should I be following up with you? And what can I do now to prevent future issues? These are all important questions. If you're having any symptoms, what could be causing this symptom? I don't know if you know this, but many symptoms, if we take them and we separate them amongst all the different disease processes, one symptom could be included in 15 different conditions. And so understanding what could be causing the symptom that you're having is important. Are there any other tests that we should be considering? Is there anything else we need to do? When should I be concerned or when should I follow up? Those are really good questions to ask your healthcare provider and get the answers for before you leave. If there's a treatment plan put into place, like what are my options? Let's just say you come in with high blood pressure and you don't really want to take a prescription, but you want to do something natural. Depending on the level of your blood pressure, you may be able to make some lifestyle modifications and change your diet and things of that nature and take a watch and wait approach. However, if you come in, your blood pressure is 150, 160 over one something, that may not be an option right now. We may need to look at looking at blood work, seeing what's going on there, and then making those lifestyle modifications, right? And starting medication if necessary, and then slowly trying to wean things off as the blood pressure begins to go down. What lifestyle changes can I try first? We just talked about that, right? And what are the risks and benefits of this plan? So this is what I like, Dr. Latoya Wells, the nurse practitioner, this is what you're offering. How can we meet in the middle? And as your healthcare provider, I want to talk about that, but I want to also give you the realistic plan, right? And then see how we can meet in the middle with that. Other things about medication. Why am I taking this medication? If you are being prescribed something or you're taking a medication, you should know why you're taking that medication, what the side effects are, and what are some of the alternatives. I have seen so many patients who are on medication, and when you ask them why they're taking it, oh, the doctor just told me. Oh, the lady just told me to take this medication, but they don't know why they're taking it. They don't know how often they're taking it. They don't know any of the side effects or potential side effects of the medication. They don't know how it works. So you want to know what the mechanism of action is. Like, what is this medication doing to help my high blood pressure? How does that work? What is it doing? How to advocate for yourself. Advocacy is not confrontation. It's providing clarity, right? You're not being confrontational. You just want to know what's going on with yourself. So if something doesn't feel addressed, I'd like to understand this better. Is a great way. Can you help me understand this better? I need more clarity on this. I'm not sure 100% on what you just said to me or what this medication or what this condition is. Can you provide me information so that I can better understand it? Ask for clarification. Can you explain it in simpler terms? You're throwing out a lot of medical terminology for me. Can you put it in layman's terms so that I can understand? I don't know what osteoporosis is, but can you tell me that it's softening of the bone? Or I don't know what gastrointestinal illness is, but I do know a stomach bug. I know what that is, right? And don't rush yourself. If you feel rushed by the healthcare provider, make sure you say, I have a few more questions before we finish. Or I just need a little bit more time. Is that feasible during this visit? And depending on what's going on in that visit, if there's too many issues that are being discussed, they may ask you to come back for another session. Just because, to be fair, the healthcare providers do have a schedule and they have other patients waiting. And so, one of the good things that I'm just going to throw this shameless plug out there, one of the good things about Wealth Legacy Health and Wellness is we provide that time blocking for our patients so that you have the time to ask those questions and you don't feel rushed. For our new patients, we schedule every 60 minutes. Many times we're done before those 60 minutes, but it gives us that time in the event that there are questions or we need to go over a few more things. And making sure that you're leaving that appointment feeling like you have accomplished your goal and your mission for having the appointment. Take notes. Ask them, can you summarize the plan for me and write things down? I can't tell you how many times my husband's gone for an appointment, which he's good at scheduling his appointment. But when I asked him what the provider said, well, I don't know, they said something about the something. I don't know what the something about the something is. Take notes. Know that you can get a second opinion. That is your right. So if you go to a provider and you just don't, you're not feeling what they're saying, and it could just be you not wanting to accept the information that they're giving you, you have the right to go and get a second opinion. Or maybe things don't sound right or it just doesn't sit well with you. You have the right to go get a second opinion. And how do you know if a provider is a good fit for you? This is a big one. And it's often overlooked. Many times we get referrals to a provider and we feel like because our friend went or somebody we know went, they had a pleasant experience, that the same is going to hold true for you. Everybody has different personalities, everybody understands things, and some people just don't mesh well, and that's okay. A good provider listens without interrupting. They explain things clearly to you. They include you in the decision making. They respect your concerns. They don't dismiss your symptoms, and they look at the whole person and not just the numbers. Some red flags that we need to look at and be mindful of. If you feel rushed in every visit, I had that happen to me. I had a provider, I would go in and my appointment was at 10, let's just say. That provider didn't come in that room until 10:45. And at 10:50, they were walking out of the room. Now, mind you, my appointment was at 10. I waited 45 minutes for this provider to come in for 5 minutes. And I felt so rushed. I felt dismissed. I felt unheard. And eventually I did go somewhere else. Your concerns are minimized. Oh, it's nothing, but you leave confused. I've had that happen, and I've actually fired several providers because of that. And when I go in to an appointment, I don't go in as a provider myself. I go in as a patient. And I think I've shared here and on social media how I felt so confused and so dismissed by a provider that I've seen recently. And I've since found someone else. And it was just disheartening. There's no clear plan on what's going to happen, and you don't feel comfortable asking questions. Ask yourself, do I feel heard? Do I understand my health better after this visit? And do I feel like we're working as a team? And if the answer is no, it may be time to find a provider that aligns with you and that's able to help you and make you feel comfortable. Now, when it comes to wellness, what are some of the things that I want to provide you in terms of some tips? Schedule your annual exam every year. And one way that you don't forget is when you leave that appointment, schedule one for the next year. So that way it's already on your calendar, it's already booked. You don't have to wait when you think about, oh my goodness, I haven't scheduled that appointment. And then you call the schedule and they're booked out for 6 months. Don't wait for symptoms to show up. Follow up on your labs. Don't just assume no news is good news. Be honest about your habits. This is a judgment free space, and it should be. And stay consistent with your preventative care. As we wrap up this discussion, I just have a few things that I want to talk about. Your physical exam is more than just a checkup. It's an opportunity for you to pause and ask, how am I really doing? Kind of get a temperature check on your health care and your voice. Is my voice being heard during this visit? Is my provider listening to me? It belongs in every healthcare conversation. Again, it's not just monologue, the provider talking to you and you not being able to say anything back. It's dialogue. There's communication back and forth between you and that provider. At Wells Legacy Health and Wellness, we believe partnership, education, and prevention because we're not just treating an illness, right? We're not just treating an illness or symptoms. We're creating a legacy of good health. So I ask you, if it's been over a year since your last physical exam, schedule that appointment. Prepare your questions and show up ready to advocate for yourself. And if you're looking for a provider who can listen, who educates, and who partners with you, we are here waiting for you to schedule your appointment. We offer early morning, evening, and weekend appointments. We offer in office, virtual visit, as well as convenient care. And what does that mean? Care that's convenient to you in whatever location is convenient to you. If you're on vacation and you're visiting Florida and you need to be seen, we can come to your hotel or your resort or your Airbnb. If you're at home and you're sick and you can't leave, we can get to your home and see you. If you're at your office and you go into work feeling fine and midday you start feeling not so well, we can come to your office and see you. So convenient care, and that's exactly what it is. And that's one of the things I pride ourselves on, being able to meet our patients where they are and provide care in many different environments that helps our patients. It's all about creating a legacy of good health and not inconveniencing you. So I just want to say thank you so much for listening into this Wellness Wednesday. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. We are open full time and we're accepting new patients. We're also still accepting many major insurances. So spread the news. I can't wait to see you and help you create a legacy of good health. Stay safe and be well. Until next time. Bye.